If you are one of the thousands of Utahns who can't afford health insurance but don't qualify for Medicaid, the Maliheh Clinic is here to help. Maliheh Clinic seeks to improve the quality of life of the greater Salt Lake area by providing free medical services for uninsured and low-income individuals and families to help reverse the cycle of poverty and suffering created by poor health. The Maliheh Free Clinic is the medical home for 6,000 low-income, uninsured individuals and families in our community. All of the clinic's patients are low-income families earning below 150% of the federal poverty guidelines. These families have no health insurance, nor are they eligible for Medicare, Medicaid, CHIP, or homeless services because of their income level. The Maliheh Clinic focuses on primary and preventative care, but also provides family practice, pediatrics, gynecology, cardiology, dermatology, podiatry, ophthalmology, surgery, and dentistry. Serving an average of 85 to 100 patients each day, the Maliheh Clinic has 8 full-time staff and nearly 400 volunteers. The dedicated and diverse volunteers are what make the clinic special. They consist of physicians, nurses, interpreters, patient techs, medical assistants, nurse educators, and office assistants. As a non-profit 501c3 charitable organization, the Maliheh Clinic relies on federal grants, private donations, and generosity of many institutions, including the University of Utah, in order to provide the array of services it does. Opened in 2005 by emergency room doctors and nurses who saw the need for free health care for the working poor in our community with financial support from the Khosrow Samnani family. Khosrow Samnani had a humble upbringing in Iran as the fourth of 7 children. He arrived in Salt Lake City in 1969 and has received a master's degree in engineering administration from the University of Utah while working as a janitor. The clinic is named after his grandmother, who taught him compassion and the value and need for giving back to your community. Because poor people suffer higher rates of medical morbidity and premature mortality and receive disproportionately less medical care than their affluent counterparts, they deserve a chance to be healthy, and those of us who are more fortunate have a duty to help them. One of the larger goals in the Maliheh Clinic is to offer hope to people who might otherwise have little. To quote U.S. Navy Vice Admiral Adam M. Robinson, Jr., "Hope is the essence of what fires our souls and provides light in our world. Hope becomes a beacon that shows us the way from darkness and desolation to light and life." The Maliheh Clinic attempts to help people once again become healthy and productive members of society and thereby change their impact from negative to positive. The importance of the Maliheh Free Clinic is evident in the faces of those that are served there and those that serve there. If the state of Utah decides to expand Medicare one day, it's possible the clinic would be obsolete, but that wouldn't faze the executive director, Jeannie Aspey. "Feel free to put us out of business," she jokes.